Hi Meena, welcome to our first series of Praxis Convos. Thanks so much for taking out the time. Would love to know that what impact was created by COVID, and where are you guys back on track now, and not just Portea but generally about the sector.
Sure.
And our like this, what's happened all these last 2 months.
Portea is in the outside of hospital healthcare space, and we use technology to provide to support the various forms of healthcare that we offer to patients at home, at work, or just through technology if that's how they want to consume it. And we've been obviously working with patients directly as they come to us, but also we work extensively with hospitals who need support for their patients post-hospitalization or post-treatment that happens in the hospital. As soon as lockdown started, there was obviously a huge impact because our services requires that our people go into people's homes and provide the services on a day-to-day basis. So the lockdown and all the logistics naturally created a huge disruption in how we are able to provide the service. The good thing is that just in advance of that, we had started to move a lot of our caregivers and nurses into patients' home and said that you just stay there instead of doing the commute. So that sort of gave us a little bit of headroom, and we were able to continue with the services. Otherwise, we would have been hit even more significantly. So April, we did see a 30% drop in revenues, partly because of the lockdown effect, partly because things like physiotherapy, which are not seen as critical mandatory services, but as something which is more elective, people chose not to take those at the current moment, and having somebody coming into your home to do these services was a little bit of a challenge. But what was also interesting that towards the end of April, we started to see different kinds of tailwinds come in. Of course, at the moment there was a announcement on teleconsultation guidelines. Even before that, we were doing, but we were able to quickly ramp up that, and we not just support our own patients, we even supported the Karnataka state for non-COVID queries. They were looking for some support. We urgently put that together. And then now a lot of corporates and insurance companies are looking at these services. The interesting thing is this is not just pure teleconsulting, which is just getting a doctor to do that. That's of course one piece, but we are able to create interesting solutions around, for instance, infection control for insurance companies. So basically, today, all insurance policies really kick in when a patient goes into a hospital. And that whole route being impacted because of COVID, because of patients' behavior, fears, all of that, it means that in many conditions and many situations, people are not able to get the help that they need. So what insurance companies are saying, let's put together an end-to-end solution, which means that if somebody has any kind of a symptom, they call in a helpline, we triage it, we do a teleconsult, and then we decide whether they need support at home, they need support in a hospital, and then take them into that space. And the whole thing is covered by insurance. That's a fundamental difference than what earlier it was. So teleconsulting, but with a very, very different objective and outcome, meant for a closed user group of the insurance company, all their insured people, and so on. So interesting, different kinds of solutions have started to come. The other piece which is interesting that has started to come is what the pharma companies have spoken to us. They said that patients can't go to doctors' clinics to get consultation. So the therapy is not commencing or the therapy is not continuing, and that's a big issue from a compliance perspective. So how do we help the teleconsult to happen, but more importantly, continue the therapy thereafter at home? And continuing the therapy in many cases meant that an injection is given or an IV infusion, or interestingly, they've even come back to us and say, can you provide chemotherapy end-to-end solution at home? So these are some of the things that started off with pharma course. The third piece, which is I think which is probably the largest, the most impactful for us, is that as the number of COVID cases are becoming more and hospitalization or hospital care is not adequate and is not the only way to take care of these COVID patients who are asymptomatic or mildly symptomatic, some of the states have asked us to work on a home-based isolation solution for them, which we have started to offer, and that's a fairly large piece. And going forward, I see this is something which will not just be, I mean, COVID itself will take a few months, and some people say 6 months, 9 months, a year, whatever period that goes on to. Keeping people at home, managing them, monitoring them, and ensuring that only when they really need are they going into a hospital is something which is becoming more normal. I feel that the regulators are also taking notice of outside of hospital care as an important piece of the overall ecosystem.
How has the consumer behavior and the patient behavior changed? In the
Yeah.
what have you seen in the short term? What do you think will happen in the long term? And specifically, I think for healthcare needs, it's such a complex area, right? That it's very difficult to put all sort of look at everything in a holistic manner. You need to look at patients who are by city tiers, by age, by acute versus chronic. Depending on these 3-4 axes, the behavior would change very differently, right? So what have you seen in the last, let's say, 2 months, and what do you think will happen for the longer term?
This has forced people to look at technology based solution as a important part of their consideration set. Earlier they would not have. Earlier they would have said, let's just walk to the neighboring clinic and talk to somebody. But even people of different age groups and different demographics are saying this is the only way because there is no other alternative. So let me get started with a teleconsult, with a video consult, what have you, and then if required, we'll move on. So that whole getting more comfortable with accessing healthcare through technology is something which I've seen a behavioral shift. That said, in a country like India, I don't think that will be the only way in which people will consume. I mean, it cannot be a wholesale shift. People will still want face-to-face. People will still want things to happen at their homes and at the clinic. It's just that this the overall journey is now extending beyond just one or the other, in the home or the facility. It's becoming more technology plus face-to-face. That's the change that I'm seeing. The second thing I'm seeing is that there is a lot more of paranoia about visiting a facility, a lot more of paranoia about who you allow into your home as well. So people are looking at more branded providers and people who they think they can trust to have done the due diligence, to have done the screening of people before they are brought into their homes. So it's not about the price is important, but this becomes primary. You can't just rely on anybody. You have to go with somebody who you can trust that they will do the right things for you. Third change, I think, is there's a lot more of community-based care, as in community-based interaction, or people are asking each other. People want to rely on what the community is referring rather than just going out and on their own consuming something, because the trust factor is something which has become even more important today. So these are some of the behavioral changes that I'm seeing. Another interesting behavioral change that I saw is that people came and told us that consumers and patients have asked us, can you do chemotherapy at home? And oh, by the way, if my oncologist is saying no, then can you connect me to an oncologist who will allow me to do that? And that was something which I've never ever experienced in my entire 7 years in this. Nobody is going to say, I will choose a doctor based on whether I can get the therapy at home or not. That's completely unimagined. Of course, it's anecdotal, but I'm just saying the people are looking at things a little differently than they may have in the past.
What's happened with chemotherapy? I know. So has government sort of not allowed for this duration, and now sort of they're letting hospitals do this. What's the regulatory sort of what's happened to it during the last 2 months?
Government initially had said that OPD and anything which is not emergency, which is seen as elective, they did not want to bring back and want people to come to the hospitals. That has, of course, now been removed. So people can come for OPD and electives, and slowly the elective surgeries in Manipal, which is close to my home, between the last 10 days, I've seen the footfall become 3x. So that's the kind of change that has happened. So people are starting to come back. But I don't think ever there was any, there would have been a restriction on people getting a therapy like chemotherapy in a hospital. I don't think there was any restriction, because that's part of it's a critical service. I mean, you can't say that, okay, let me push my cycle out by 4 weeks because we are on lockdown. So there was no restriction. because that people did not want to do that. There was a lot more of fear. So that's where I was coming from. And doctors also did not want to bring their patients in because they were probably more immunocompromised. So they were also a little paranoid.
Thanks so much for taking out your time, Meena. Wonderful talking to you. Wish you all the best, all the health, and all the best to you and your family and your loved ones.